And it's that time again. Hi, everyone. Happy Monday. Welcome to remarnurse.com. We're going to talk about peritoneal dialysis. So if you are studying for NCLEX, show up to this class mentally. Get ready for the questions that I'm going to have after we do our content review. I don't even really know where this class is going to go actually, but I can tell you this. Hello, my name is Professor Regina MSN RN, and I am the #1 NCLEX instructor on the planet. I have people here from the Americas, North and South. I have people here from Africa. I have people here from all over the planet. Ireland is in the house, y'all. This is an amazing Monday for us to start off our week. If you are in the US, it is a federal holiday today. It is Memorial Day. And Memorial Day is a time when we reflect on and appreciate those who have lost their lives in defending our country, defending our freedoms. And I know for me as an American citizen, I appreciate the freedoms. I can take my American passport and travel all over the globe. It is such a unique place and opportunity if you are from the States, if you are from the States. But did you know this about Memorial Day? Did you know this about Memorial Day? I actually learned that Memorial Day was started by free slaves, was started by those who were once enslaved, but then they gained their freedom May 1st, 1865 in Charleston, South Carolina. And it was actually first called Decoration Day. And what happened is the soldiers who lost their lives defending our country, those who were part of the Union, their bodies were not able to be properly buried. And so these free African Americans, what they did was them and their children, they decided that they were going to hold a parade for all of those soldiers who had lost their lives. And so they did that. They called it Decoration Day. That was the start of Memorial Day. So yes, tell your children the story of the history of that. I just loved it so much. So I will just be sharing that knowledge. And hey, I'll be sharing other knowledge too. Again, we're going to be talking about peritoneal dialysis on today. Don't forget, in just a few days, the month of June is coming. We're at the end of May. The month of June is coming. And during the month of June, we have Remar Nurse University. Every Monday in June, we are going to be hitting hard pharmacology. And so this is a free NCLEX review I don't want you to miss. As you can see, June 3rd, June 10th, June 17th, and June 24th, you have an assignment, 8 p.m. Eastern Standard Time. I will be doing a free class. I'm going to launch it right here from YouTube, from Facebook, so that you can watch it. But it would be great if you signed up at remarnurse.com/RNU. If you are taking NCLEX, this is going to give you all of the elements that will help you prepare next generation review, of course, pharmacology, prioritization. We're going to talk about the CAT exams. We're going to talk about delegation. There is a workbook that is coming out. I expect that to come out on Wednesday so that you have enough time to prepare to print it out for next Monday evening's class. But again, you won't know what's happening if you don't sign up for it. remarnurse.com/RNU. You have nothing to lose. It's free. Tap into this class. But today, I have the pleasure of working from my NCLEX review. You guys know it's V2, and there are many elements that make the process for studying for NCLEX a lot easier. I tell you, I've been saying, hey, guess what? If you're studying for NCLEX, only study from one resource. That is one of the secrets to being successful. Make sure you're getting everything from one place. And so that is why I created the V2 that has the lectures, the question bank, the computer adaptive exam, my books that I wrote, in my daily schedule that I prepared for you so that you can stay consistent and accountable. And I don't care how long you've been out of school, whether you just graduated or you graduated 10 years ago, I can help you pass the NCLEX. But I need you to use the right tools in order to get it done. I need you to use the right tools in order to get it done. Okay, it's Monday and we are live, and I am getting this testimonials. They're rolling in. I like this one. I'm back here to give the glory to Jesus, the one that never fails you. And thank you, Regina. Last Friday, 5/24/24, I took my PN NCLEX, yes, and saw the results that I passed. She said, content. That's right. That's what we focus on here. Thank you for this testimonial. We will be going over content. Nurse Brenda Desire says this. I said at the beginning of the exam, she said what I say, what you say, what we know to be our motto here. She said, I can, I will, I must pass the NCLEX RN, and did. I had to come back and say, thanks to V2 and Remar, you are the best. Hey, that's what I'm talking about. Not only just having the success, but being able to share it. Share it. So congratulations, everyone that's in here. I hope that this is your portion. You're saying congratulations today so that you will be congratulated tomorrow. How about that for a thought? Okay, we are going to get into peritoneal dialysis. Just a reminder, the reason why we are focusing on peritoneal dialysis is because there are two types of dialysis that can be presented on your NCLEX exam. They are hemodialysis and peritoneal dialysis. There are certain conditions, there are certain types of patients who would prefer the peritoneal dialysis. And so we have to be knowledgeable about the priorities of nursing care for peritoneal dialysis. Now, I will say there's not many. It is a relatively simple procedure, but you do have to know peritoneal dialysis and what are the emergencies of it. I'm going to help you do that. We're going to go over content today. So peritoneal dialysis in general, this is a what system? This is a renal system issue. Okay, this is a renal system that we're talking about. Now, when we have dialysis in play, it is because the kidneys are not functioning properly for whatever reason. Okay, many different reasons. You can get this, actually, this comes from Quick Facts for NCLEX, the book everybody should have. If you don't have this book, what are you doing? So this will be found actually in the hemodialysis section right here. Okay, so hemodialysis is one of the larger topics that is presented in the Next Gen Quick Facts. So if you don't have Next Gen Quick Facts, you don't have this page. You need it. You need this page. So it'll go over dialysis, the different access ports for dialysis, and then on page 34, we go over peritoneal dialysis. All right, so it's right there. This is what I'm working from today. Feel free to add these notes. So anyhow, peritoneal dialysis is also considered a life-sustaining procedure, and it is an alternative treatment of hemodialysis. Now, hemodialysis is great, but you have to have certain things in place before you can do hemodialysis, right? So you have to have, what's the biggest thing? You have to have an access. You have to have an access to be able to facilitate hemodialysis. Let me ask you this question. There is one medication that a patient has to be able to tolerate if they want to get hemodialysis that they don't need if they're going to do peritoneal dialysis. What is the big medication that has to be given with hemodialysis every single time? You got to give this medication. So if a patient cannot tolerate this medication, then they cannot get hemodialysis. What is it? I'm asking you to critically think right now. Was this potassium? No, not potassium. You guys got it. You got to be able to get that heparin, that anticoagulant. It has to be something that your patient can tolerate. And some patients cannot tolerate heparin. So it just cannot go systemically into their body. All right, so that is a big consideration too. I don't know if you knew that, but I wanted to draw that point out today. So when we're talking about peritoneal dialysis, it is an alternative. It is an alternative. It has many different benefits as well. So again, peritoneal dialysis denotes the location. We are using the peritoneum to accomplish what the actual dialysis machine would do. So we're using the body's own anatomy. The peritoneal dialysis is a semi-permeable membrane that allows fluid to come in and waste to be exchanged to come out. All right. Very important for us to remember. Somebody said, I didn't know that. All right. So let's break down again some other differences between hemodialysis and peritoneal dialysis that will serve you when you're taking your NCLEX. So access, we talked about you need to have a surgical access placed. Okay. With the hemodialysis, you're either getting an AV, an arterial venous fistula or graft, or no, you're getting that, or you can get a central line place, but mostly hemodialysis is going to be the graft or the fistula. All right. And that's going to be a dual lumen venous catheter. Now, how long does it take for this access to be ready to go? Okay. Because you can get the fistula or the graft placed for hemodialysis, but can you start using it right away? No, 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 no. All right. And it's in quick facts because you do need to know that. All right. So if you don't know how long it takes for the fistula or the graft, look it up. Okay. With the peritoneal dialysis, though, you're getting a catheter that can be temporary or it can be permanent, and it's going to be placed right into the peritoneum. Now, the anticoagulation requirements, we talked about this. Systemic heparinization is going to be needed when you do hemodialysis. That means that the body is going to have to be able to tolerate heparin going everywhere. It's going to have to be able to take that medication and be able to, be exposed to it very frequently. So with peritoneal dialysis, heparinization is not done in the same way. It can be done just in the peritoneum, which means that it will not be absorbed systemically. Length of treatment. So the length of treatment can be pretty similar. The difference is where it's done and how the patient has to be during the time. So for hemodialysis, you have to travel to a location to get this done. Nobody has a dialysis machine sitting in their home. It's at a facility, and it has to be administered by nurses, trained professionals. You have to do this a couple times a week. Usually it's 3 times a week. So your Mondays, your Wednesdays, and your Fridays, if you're on dialysis, you're leaving somewhere. All right. And it could take between 3 and 5 hours, depending on how swollen the patient is, how much fluid they have to get off. All right. Whereas peritoneal dialysis is done where? It's done in your home. It's done in a home environment. And the patient is able to hook themselves up. It is done by gravity. They have new machines that do it now, but for NCLEX, understand peritoneal dialysis is done at home. It's done via a process of osmosis and gravity. The time can be 4 to 6 hours. Okay. However, it's 4 to 6 hours of you doing what? You're cooking, you're watching TV, you're moving around, you're in the comfort of your own home. And so that is a significant benefit to a patient who is required to have dialysis done. Now, let's talk about the advantages and disadvantages. Again, for peritoneal dialysis, when compared to hemodialysis, another advantage is that it requires, of course, less equipment. Patients are able to do it at home. They're able to manage it. You have less hemodynamic changes because the process is not done so abruptly with a machine. It is done through osmosis. And so the patients rarely have issues where they're having hypotension after the procedure. They're not feeling well. Okay. There are also fewer dietary restrictions. Why would that be? Why would a patient on peritoneal dialysis have fewer restrictions, can eat more of what they want than a patient on hemodialysis? That's a good critical thinking question. I'm really here to push you today. I'm going to what I say, I'm going to cook y'all up today with these questions too because they're challenging, but I don't want us to take for granted that we still have a lot of learning to do, even with a subject like peritoneal dialysis. So I'm asking the question here, why can patients with peritoneal dialysis be a little more lenient on what they can eat? Why is that? Why do we think that is? And so one of the challenges that we have to consider as we're preparing for NCLEX is that we have to know enough about a subject to feel comfortable, but not so much that we feel like we know it all. Okay, that we feel like we know it all. Because when a nurse gets to a point where she feels like she knows everything, then she's not teachable and she's not flexible. All right, so let me see here. Okay, oh, let me see. Hi, everyone. Hello. I'm glad you're here. Because one is straight through the body directly, the other goes through the stomach because they do it every day. Able to move, hence metabolism and elimination rate increased. Okay, so very good, very good. These are all great considerations. Thank you, class. The idea is that you do peritoneal dialysis more frequently. You actually do it more frequently because you're doing it at home. And since you're able to remove waste on a more frequent basis, it gives you a little bit more room in terms of how much fluid you can take on because you're just going to remove it. You're going to remove it, right? More frequently. Whereas a person who is only getting treatment 3 times a week, you might have a whole day or 2 days before the waste is eliminated. So think about that when you are preparing for NCLEX, because your case studies can reflect those types of nuances. Does he know? Does he know peritoneal dialysis versus hemodialysis? Is it a deep knowledge or is it just a surface knowledge? All right. I want you to have deep knowledge. Let's go deeper. Manageable at home. So the disadvantages of peritoneal dialysis is that they do require more time. You're doing it more frequently. Peritonitis is a huge complication of peritoneal dialysis, very significant complication. You need to know peritonitis. You need to know peritonitis like the back of your hand, okay? The waste is removed more slowly, so it can take a little bit more time. And of course, during peritoneal dialysis, you are going to feel a discomfort during that time. All right. I have almost 900 nurses who have showed up on a Monday to an NCLEX review class. Let me tell you how amazing you are for that, because you're doing it for you. You're not doing it for me. Let me tell you how many else are coming to Remar Nurse University. Over 20,000 of you have already signed up for RNU. Huge. And I don't know if it's because we're going over pharmacology or if this is the time where people are just like, this is my last year studying for NCLEX. But this number reflects where we are mentally. We're serious about this thing. This is it. This is it. So if you have not signed up for RNU, get into it. Get into it. Remar Nurse University is coming. It's coming in June. Yes, and it is a holiday. And y'all here, I am like, my mind is blown. Remar Nurse University. This is it. Somebody said, that's it. This is my last year studying for the NCLEX. I can see that. I can see that. Okay, so for my audio visual learners, you know I got y'all. If you have no idea where the peritoneum is and you don't know what I'm talking about, here's your visual. All right. So you have an apron that sits over your abdomen called the peritoneum. Yeah. And it has a membrane in it that allows things to come in and out. It's very interesting how they even discovered that this was possible. So you'll get a catheter placed. The patient will get a catheter placed that will allow a fluid to come into the peritoneum. And then at another certain time, this catheter will drain out the waste products that have been collected into a different bag. So I have there the two bags, just in case you weren't familiar, because there's actually two procedures that happen when a patient gets peritoneal dialysis. The bag at the top reflects the dialysate going in. And then when it's time to remove the waste, another collection bag is placed below the patient's knees, right? Below, down, and so that waste can come out into a different bag. So it's a two-step process for peritoneal dialysis. Our nursing considerations, the complications are, of course, this: if all of the fluid that has been instilled cannot be removed. So an incomplete recovery of fluid. And I have here for my readers, the fluid that is removed should equal or exceed the amount infused. If after several exchanges, the volume drained is less than 500 milliliters or more, then the amount infused, an evaluation has to be made. Is the tubing kinked? Why is that fluid not returning out to us? Very important consideration. Leakage around the catheter is a superficial leakage, means surface. After surgery, it may be controlled with extra sutures or a decrease in the amount of the dialysate that is instilled into the peritoneum. But if you have increases in intra-abdominal pressure, this may also cause the dialysate to leak. So leakage is also an issue. Blood-tinged peritoneal fluids. Blood-tinged peritoneal fluid. Is this normal? Is this expected? So it is expected in the initial outflow, but should clear after a few exchanges. Okay. Now, gross bleeding at any time is not okay. It's an indication of a more serious problem, and it has to be investigated immediately. Peritonitis. Peritonitis is serious, but it is also manageable. But you have to know the signs of peritonitis, because peritonitis can be deadly too. So signs of peritonitis, let me give them to you: low-grade fever, abdominal pain when fluid is being inserted, and cloudy peritoneal drainage fluids. Okay. Catheter infection, of course, whenever we put something into a sterile cavity, something that is not natural to the body, it is a foreign object, there is a possibility of infection. And so during a daily dressing change, the nurse should examine the exit site, and we're looking for signs of infection, such as tenderness, redness, and drainage around the catheter. Good stuff. If you're a nurse, you're loving this stuff. Hey, Tammy, how are you? Hi, Regina. I just wanted to say hi. I will be finishing my master's. Y'all don't know, Tammy is a Remar miracle. And so she popped up here today, Tammy, to tell me FNP in August. Come on, y'all better graduate. Tammy's story is amazing. Look, I don't know if you got time, but I got time today for you. So if you can hop on, please let me know. Thanks so much. I was a repeat test taker. This review saved me. Love you, M. Mark. That's amazing. Tammy Russell, y'all, she is a Remar 18 times that she struggled with the NCLEX. And it is, you can read that and you can be shocked by the number, like thinking like, wow, 18 times, like, wow, how can you have sit for this NCLEX 18 times? And you can focus on the number, right, 18, or you can focus on what it takes to pick yourself up after that many times of not having success. You can focus on the type of perseverance that is necessary to come back to something. You can focus on the mentality of, I will do this. I have to do this. I can do this, that Tammy actually exhibited. And now what is stopping her? Nothing. As she has said, I've done NCLEX and now I'm about to be writing prescriptions. Even after the failure, now I'm about to write prescriptions as a FNP. What? What? Come on. So, whatever little excuse that you are struggling with, I need y'all to come out of it. I really need y'all to recognize your own potential and what you can do. So good. It's so good, man. Monday motivation. How to prevent infection. Because I could keep on that thing. That is a miracle. You talk about a miracle. Y'all be thinking, miracles are all these like bam. No, a miracle is just being able to show up for the NCLEX after you failed it 4 times, 5 times, 6 times. That's a miracle. All right. Anyways, peritoneal dialysis. Let's go back into it. How to prevent an infection during peritoneal dialysis. Because you are infiltrating the skin, all right, you need to keep your hands clean during the entire process. The dialysis bags, they're made of sealed plastic to help. All right. As prescribed, you're replacing the tubing very frequently. Some of these things are just common sense that we learn in nursing school. We're cleaning the injection ports and the tubing connectors with the bactericidal solution before introducing the drugs. And sometimes it'll just come in the little the little plastic thing. You just tear it out. The solution is there. You wipe everything down. Until healing occurs, change the dressing on the exit site every single day using aseptic method. Check each day for a rise in either swelling or drainage. Yes, 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 yes. Easy things for us to do as nurses. And again, I'm excited. I'm excited because not only do we do these Monday and Wednesday classes, but sometimes we have additional things that just help support this community to get over the bridge. And so if you have not signed up for Remar Nurse University, I'm going to keep saying it because June is coming, and Remar Nurse University can be the difference between somebody being consistent and somebody just closing down the laptop and saying, I'm done. I can't do this anymore. And so every opportunity that you have to show up for something like this, take advantage of it, because people are charging hundreds of dollars, all right, for NCLEX prep. And I'm doing it for free. I just need you to show up. The investment is you. The investment is time. remarnurse.com/RNU. All right. There it is again. All right. Hey, here we go. NCLEX questions. We went over the content. I have expected you to have studied it from Quick Facts. And now I want to test that you actually have done so. So I am open to all things happening during these next 5 questions, whether you get them all right or you get them all wrong. Okay. The goal is, number 1, that you showed up. And number 2, you try to get 3 of them. You just try to get 3 of them right. Okay. Because we went over some important concepts during the content. So just try to get 3. Okay. Deal. Here we go. First question is this. 55-year-old patient with end-stage renal disease on peritoneal dialysis presents to the emergency room with complaints of abdominal pain and cloudy dialysate. Which of the following actions should the nurse prioritize? Number 1, notify the physician. 2, administer IV antibiotics as prescribed. 3, collect the specimen. 4, initiate peritoneal dialysis for waste removal. What do you think? I got answers all over the place. Lots of 1s, lots of 2s, lots of 3s. Nobody picked 4, but 1, 2, and 3, top contenders. I'm just gonna give you the answer. I'm gonna give you the answer. 3 is the right answer. Collect a specimen. We have been going over this, y'all. We have been going over this ad nauseum, but it's okay. It's okay because I have the patience for this today. Remember, when we are doing our NCLEX questions, don't get ahead of yourself. Every detail in the question is to give you the answer. Come on, let's do it again. 55-year-old patient with end-stage renal dialysis. Okay, we already know that. We're talking about what? Peritoneal dialysis. That's what we're talking about. That's the major answer point right there. The second is the location. Why does the location matter? The location matters because your nursing process is dictated by many things, but location is one of them. So if the patient is coming in the ER, do we know this patient? What? Is this a new condition? Yes. So what do we need to do? We don't need to focus on anything but what? If this is the first time you're seeing this patient, the first time they're showing up because you're in the emergency room, our nursing process tells us to assess. Okay, assess. So, number one, notifying the physician, not assessment. Two, administering IV antibiotics, not assessment. Nobody picked four. Three, collecting a specimen, assessment. Because what? Patient may have what? Peritonitis. What could the peritonitis be caused by? I don't know. All right. I have no idea. So we're going to continue to do this until you get every one of them right. That's why I come up on Monday. I only ask y'all for 2 days. Only 2 days I ask you to show up, and that's Mondays and Wednesdays. And this is the reason why. Because we learn together as a group. We're going to get through this. Okay. All right. Let's do question number 2. A patient undergoing peritoneal dialysis is prescribed vancomycin for peritonitis. Which of the following methods of medication administration is most appropriate? Number 1, add vancomycin to the dialysis solution. 2, administer vancomycin intravenously. 3, administer vancomycin orally. 4, inject vancomycin intramuscularly. What do we say? Okay. All right. I didn't give you the answer to this. I'm just wanting you to, this one is a straight out the jump critical thinking one. And this is one of those situations where you're going to be in the NCLEX and you're going to say, what? Like, nobody never told me this. I never had to give any medication for peritonitis. I don't know. And you're really just going to have to use what I've been telling you to use, which is up here in the question. The question gives you the answer. That's all I'm going to say. Once again. All right, correct answer here is number 1, adding vancomycin to the dialysate solution. Why? For a patient with peritonitis undergoing peritoneal dialysis. Okay, it says here the patient is undergoing peritoneal dialysis. All right, so adding vancomycin directly to the dialysate solution is the most appropriate because it's going to put the medication where it needs to go. It's going to put the medication where it needs to go, and that is in the peritoneum. So if you knew that, if you're learning, okay, same thing. This is a safe environment here. This is a safe environment. So you're learning great. You knew it great. Okay, I'm moving on. Question number 3 says this: a nurse is preparing to administer a peritoneal dialysis exchange for a patient. Which of the following is most important to ensure proper procedure and prevent infection? Number 1, warm the dialysate to body temperature. 2, verify the client with another nurse. 3, use sterile technique when connecting the dialysate tubing. 4, position the patient in a semi-Fowler's position. Whew. I love these questions today. I love them all. I can't pick a favorite. They're all so good. So anyways, read the question, give me the right answer. Great job. Shout out to all of the Remar nurses that showed up. Over 1,000 now, over 1,000 right now. Boom. Never seen something like this before. Our community is amazing. Okay, I'm not going to dramatize this one. The correct answer is number 3. We are talking about proper procedure and preventing infection. Proper procedure and preventing infection. So this one was kind of easy because it is reflected in the answer using sterile technique when connecting the dialysate tubing. So using sterile technique when connecting the dialysate tubing is the most important step to prevent infection during peritoneal dialysis. This helps to minimize the risk of introducing pathogens into the peritoneal cavity, which can lead to peritonitis. Got it. Okay. During peritoneal dialysis, this is question number 4. During peritoneal dialysis, the nurse noted a blood-tinged peritoneal fluid. What should the nurse anticipate to be ordered? Number 1, antibiotics. 2, increase fluid volume. 3, continue monitoring. Or 4, blood transfusion. What do we say here? If you showed up for the content, this question is easy. Okay? If you were paying attention during the class, this question is easy. Blood tinged peritoneal fluid, what we're going to do, we're going to do number 3. Continue monitoring. Blood tinged peritoneal fluid is expected in the initial outflow, but should clear after a few exchanges. Gross bleeding at any time is an indication of a more serious problem and must be investigated immediately. All right. So for NCLEX, okay, for NCLEX, when you see this, I want you to lean towards continue monitoring and don't think that it is something that has to be like a major issue. That's what I wanted. Because remember, for NCLEX, what are you doing? You're looking at the choices that are in front of you and you're picking the best one in front of you. If you start coming up with choices in your head, then it's gonna be more difficult. So if I see blood tinged peritoneal fluid on NCLEX and my choices are antibiotics, increase fluid volume, continue monitoring, or blood transfusion, which one do I need to go with? I need to look what's in front of me and go with continue monitoring. Okay. And if you're liking these questions, get in my question bank. Get in the V2 question bank because that's where these questions are coming from. All right. Here is the final question. I'm just going to give it to you today. It's challenging. Here it is. Here we go. The nurse is assigned to care for 4 patients receiving peritoneal dialysis. Everybody has peritoneal dialysis going. Which patient should the nurse prioritize assessing first? Number 1, a patient who has a blood pressure of 150/90 and +3 swelling in the legs. 2, a patient who reports abdominal pain and cloudy dialysate outflow. 3, a patient who reports nausea after dialysis treatment. Or 4, a patient reporting a feeling of fullness during their dialysis treatment. Oh my goodness. Who is the priority here? Everybody has something going on. Everybody. But who should the nurse see first? The patient with a blood pressure 150/90 and +3 swelling in the legs? A patient who reports abdominal pain and has cloudy dialysate outflow? 3, a patient who reports nausea after dialysis treatment? Or 4, a patient reporting a feeling of fullness during their dialysis treatment? Okay. Are you a safe nurse? Are you a safe nurse today? Correct answer is number 2. Number 2, peritonitis. Peritonitis. One of the signs of peritonitis is cloudy dialysate outflow. This patient has to be prioritized because the symptoms of peritonitis can be life-threatening. They could be super serious because peritonitis can lead to sepsis. And if a person gets sepsis throughout their body, it's a monster to treat. It is so difficult and annoying to treat sepsis, right? Plus, your organs can start to fail, and that's much bigger than somebody just having a high blood pressure or swelling or tachycardia. So I would always prioritize peritonitis, especially when you're talking about peritoneal dialysis. Okay, so again, this is what it is about: showing up for class on Monday and Wednesday so that we can do these types of activities, because training requires consistency. Okay. Training requires consistency. If you're not happy with where you are today, what does that mean for you? That just means that you need to put in place a way. All right. You need to take the next step to get where you need to be. Is that spending more time in content? Is that getting the V2 and finally making this thing real? Okay. Is that studying some more in the question bank? Do you have this book? Okay. All these things are part of your own evaluation. All these things are part of your own evaluation. Okay, Monday motivation. God can change things in a moment. This is something that I am asking you to help me get through, because the reality that moment by moment things can get better for you is really hard to hold on to, especially when things don't seem like they're going in your favor. Okay, okay. This is a good question. Are we going to have Monday motivation in June in the morning? Am I going to do it twice a day? Let me pray on that. I think so. I think so. But y'all keep me in prayer, because that is a lot. Okay, so the Samaritan woman. It's something about this story, Jesus talking to the Samaritan woman, that is one of my favorites in the Bible. If you have not heard this story, give me 2 seconds. I'm gonna get through it, right? But Jesus speaking with a Samaritan woman is so, it just resonates with me. Okay, it just resonates with me because when people have personal encounters with God in the Bible, they're changed. And you can experience the same kind of transformation. It's good to have, worship in a group setting. It's good to read the Bible in a group setting, but when you get one-on-one time with Jesus, your life can really change. And so this story, you find Jesus in John 4. Lord, help me to just read this. He's traveling through Samaria. And Samaria is not a place where the Jewish people would normally feel comfortable, because they think entirely that they're better than the Samaritans. Jewish people look at Samaritans as second-class citizens. So kind of like, how slavery was, where Blacks were seen as second-class citizens. It's much like that. The Jews and the Samaritans, they don't mix. Anyways, Jesus stops at a well, Jacob's well, because he has a need. Your savior in the Bible has a need. He is tired and he is thirsty. And that's one thing I love about Christ, is because he understands the needs of humanity. When we approach him, he looks at us and he says, this is a person that is struggling in a world of literal sin. They have a world that has been destroyed, that has been ravished, that they experience death. It's not ideal here on earth. As beautiful as it is, y'all know we go through some trials here. And so Jesus understands those trials. He had a need himself. He was tired and he was thirsty. Anyways, this woman comes to the well. And in particular, it talks about when she came to the well. She came to the well when everybody else was gone, right? When all the other women were gone, she comes to the well. This is important because you only go places by yourself when you are an outcast. So this woman was absolutely an outcast in society. She was not married. Anyways, she comes up to the well and Jesus asks the woman for a drink. And the woman says to him, "You're a Jewish person and you're asking me, a Samaritan woman, how can you ask me for a drink? How can you, this man, ask me, a woman, for a drink? But Jesus doesn't care about all this stuff. He does not, it doesn't matter to him where you come from, what your background is, what your history is. Jesus answered her and said, if you knew the gift of God and who it is that asks you for a drink, you would have asked him and he would have given you living water. Okay, living water. And the woman said, why would I ask you that? Basically, she's looking at him and she's like, why would I ask you to give me water? She says, you have nothing to draw with. You don't have a bucket to draw with, Jesus, and this well is deep. Where can you get this living water? And this is the thing that I love about Jesus when he talks to women. Because there's so many times in the Bible where Jesus is talking to men, his disciples, and he says something that does not make sense. And the disciples say amongst themselves, well, that didn't make sense to me. What did he mean by that? But they don't ask Jesus, what are you talking about, sir? Like a woman will do. The women, this woman says, you don't make any sense to me right now, sir. How are you going to give me water? I see nothing to draw with. And so I love when Jesus has these conversations with women, because women like to get to the matter of it. They like to know, are we on the same page or not? You guys know how we do. I do this with Mark all the time, our husbands. I say to Mark, can you speak plainly to me? Make it plain. I don't want to guess what you're talking about. This is how I teach you when it comes to NCLEX. I want to speak plainly so that we're all on the same page, because I'm a woman. We don't need extra guessing. So this is what she says. She says, how can you give me water? What is this living water that you're talking about? And Jesus says to her, because he sees that she has a need. And this is this thing. Jesus has a need, but also he sees the woman having a need too. And she says, he says to her, everyone who drinks this water will be thirsty again. But whoever drinks the water I give them will never thirst. Indeed, the water I give them will become in them a spring of water welling up to eternal life, And so he takes his own need and reflects it against what the woman is there for, because the woman is coming to the water. She's coming to the well for water, just basic water. Jesus is offering her something better. The woman immediately says this. She says, sir, she recognizes that what he's talking about is much different than what she's experiencing. She recognizes that what Jesus is offering is much greater than her life is experiencing right now. So she says to him, sir, give me this water so that I won't get thirsty and have to keep coming here to draw water. She says, I don't want to keep coming here doing the same things over and over again. And so Jesus, instead of just saying, yeah, here we go, he tells her the reason why she has to keep coming here and she's not getting the living water. And I love this, because you don't see it right away, but this is the reason why she has to keep coming here, right? He says to her this, go call your husband and come back. Now, why would Jesus say that? She says, sir, give me the water so I don't have to keep coming here. And he says, go call your husband and come back. And she says, I have no husband. She says, I have no man. There is no man. And Jesus says to her, you are right when you say you have no husband. The fact is, you have had 5 husbands, and the man you have now is not your husband. And this is it. Listen, this is it right here. Jesus is saying to her, you have been trying to fill yourself up. You have been trying to satisfy your needs with men. You have been trying to get what only I can give you in men. And this is us right here. Instead of going to God with our needs, we try to get it through other things. So we try to get it through our education, right? We want to feel valued, so we try to get the education. We want to feel loved, so we're in these relationships that don't really honor ourselves or God. He says, "Go get your husband." She says, "I have no husband." He said, "No, you've had 5. You're on your 6th go around. You're on your 6th attempt to do it your way." There's a cycle that you are caught up in where you're going after things that only fulfill you for just a temporary time. You are not experiencing the living water that will lead you to eternal life because you want to do things your way. You can't see the entire picture, so you're leaning on your own understanding. And these men don't have it for you. They don't have it for you. Oh man, y'all have no idea. And so she has to reconcile to herself, because if somebody came at you and said that what you're doing is wrong and you keep doing it over and over again, you're going to die doing it the wrong way, you can get offended. Right? You can get offended. And so the woman, astonished, she comes to understand that this man is a prophet, right? She says, "For you to know that about me, you must be a prophet." And then they discussed where you should worship God and all these things. But Jesus says, at the end of the day, let me just read it because see, I get off track. They discussed the proper place of worship. Jews worshiped in Jerusalem. The Samaritans worshiped on the mountain, Gerizim. Jesus explained that true worshipers will worship God in spirit and in truth. It does not matter the location. What he was coming to do was to throw all of that stuff out the window so that it didn't matter your birthright. Jesus, his gospel is universal. It is global. He has come to save every lost soul. And so he wanted the woman to break down her preconceptions. We have these ideas that we are living by that at the end of the day don't mean nothing. We have these traditions and these thoughts that help structure our world, that at the end of the day, if you can't look at your brother and love them, if you can't forgive people and you can't live your life peaceably, everything else that you're doing will not give you that eternity that you desire. Everybody in us, there's something about death that just doesn't sit right with us, right? There's something about death that seems wrong, and losing your loved one, losing a mother, losing a father, losing a child, that it just tears you apart because it doesn't seem right. It doesn't seem right. But what Jesus is saying is that there is eternity in me. And so that need that you have, there is eternity in me. Can't get it outside of me. Can't get it outside of me. And so what I love about this story is that this encounter with Christ that she was not expecting to have, but she needed it. She needed it that day. And it changed her life. It changed her life. She went on to tell people. The woman said, "I know that Messiah is coming. When he comes, he will explain everything to us." So she was a believer. She was a believer in her own self. She knew that there was a Messiah. Jesus declared to her, "I, the one speaking to you, I am he. I am the Messiah." So don't miss it. Don't miss it. There is not another coming. Jesus Christ of Nazareth is the one that everybody was waiting for. So if you don't get this now, you're going to be waiting for something else to come along, and it's not coming. It's not coming. He declared, "I am he. I am he. I am he." Oh my goodness. This is the takeaways, and I have something even special. I told y'all a miracle was happening. I told y'all. So anyways, the takeaways from this is that just one conversation. All it takes is just one conversation. One day, Jesus can change your entire life, your entire trajectory of where you are. Jesus appreciates honesty. That's one thing I love about God, is that if you are honest with him, he can change you. But if you want to come to God pretending that you are something else, he can't change the fake you. The fake you cannot be blessed. So you have to be honest with who you are, where you are, okay? And bring your authentic self to him. All right. And then whatever mistakes in the past that you have made, whatever you have experienced that was not part of your plan or not part of God's plan, that does not stop his love for you, his intentions for you. Okay. And you can use those opportunities to find the good. All right. To find the good. Oh man, such a great Monday motivation. Such a great Monday motivation. I hope it blessed you the way it did, because I was, that's not even, anyways, another Monday motivation that I have here.
Hey, how y'all doing?
Okay, wait, can y'all hear Tammy? I can't hear Tammy. Are you
Can you hear me now?
I can't hear you now. Is it me? Can y'all hear Tammy? Just let me know if y'all can hear Tammy. More important, I can't hear.
Can y'all hear? Hello?
Let me see. They'll tell me in a minute. They'll tell me if they can hear you or not. Okay, so they can hear Tammy.
Okay.
We can hear. They can hear.
Okay. All right. Hi, ladies.
Oh man. Anyways, let me I don't know. Mark, help me.
Mark,
But anyways, Tammy, this is what I want you to do. Just give it to them, because some people have never seen you before. They don't know you. I know you, but they don't know you.
All right, ladies. Hello, Remar nurses. My name is Tammy, and I am a repeat test taker times 18. It is true. I'm not lying. I graduated with my bachelor's degree in 2000. 2000. Okay. I failed a couple of times. It was very depressing. I felt like I was just worthless. I didn't know what was doing. So I took a break. I went and got a union job that paid just as much as a nurse. So I kind of got caught up in that. I was ashamed. I didn't want to go back and test. It was just very hard for me. And then I was like, I don't want to work in this factory for the rest of my life. So I went back. I did some review courses. I did chaplain. I did something else, but I failed again. But once again, I still had my union job. So I was like, I'm not going back. I'm done. I'm tired of being disgusted. I failed again. So then I just took a break. I worked in a factory with Goodyear for 16 years. And then finally, I was like, this is not what God put me here. I want to take care of people.
Yep.
I know what I want to do. So and Regina popped up on my news feed on Facebook. I just kept seeing her. Like, I'm going to do this. I messaged her. They do the prayer, everything is there, and I just felt that connection. I did the reviews, went on and went on, and by the grace of God, and it took me a while, y'all. Like I said, I graduated in 2000, and I got my nursing license in 2020 during the pandemic. Once again, I was faced with another trials and tribulations. They put a halt on hiring. I couldn't get into the hospital, so they cut out all the elective surgeries, and it was an overload to most of the nurses here. So I had to get a job in long-term facility. I just did what I could. I learned what I could. And I went back and I got in the hospital. And then now I'm here working with the DRC, ORW in the prisons. I do contract nursing where I go dose people, give them their methadone, their Suboxone. And I just pay attention to Regina. I keep my eyes on her because I love her and Mark. And this program saved me. God saved me. It changed my life.
Amazing.
I did not give up. And I have been nursing for the past 4 years, and I decided to go back. And right now I'm in my last semester, getting my master's degree. And guess what? I'm going to go get my doctorate. Yes, I am. I'm old, but guess what? I'm going, yes, ladies, I'm 50 years old, and I will graduate in August with my master's degree as a family nurse practitioner. Yes, ma'am. Thank you, Jesus. God is good. It just wasn't my time. But you know what? I'm claiming it now. I'm doing it. I'm nursing. I've done med surg. I did post-op ortho. I've done management. I've done long-term care. And now I'm a dosing nurse. And I really enjoy that too.
Can you go back to talk about what made you keep trying?
I went to school and I've always wanted to be a nurse, but that NCLEX, that beast, it just tears you up and you're ashamed because you've been to school for 4 years and I couldn't get it. And I just have a passion for taking care of people, and that's what I wanted to do. I still was sitting privately with people, but I didn't have my license, and that's what I wanted to do. I kept asking God, what is wrong with me? What is your plan? Why can't I get this? I just kept going back and going back. The machine just kept shutting off. I didn't know what was wrong. It was just hard. But then I just picked myself up, and my mom was like, girl, you got to go on and get them nursing license. You got to go and do what you got to do. And I was like, Mom, tired. I'm just tired. Because you're embarrassed. Because when you get that little small envelope and it doesn't have your license in it, I just fell out on the ground in the front yard, just crying. Crying, embarrassed in front of my girls. My daughter was like, Mom, it's going to be okay. But they just don't know. I waste like $5,000 taking this test. 5,000, not including the cost of going to school. And I knew this is what I want to do, so I just went back. I finally got it, thanks to you.
Thank you so much. Thank you. Is it easier after NCLEX, or does it get more difficult?
The master's program is busy. It's busy. The test can be a little bit tricky. Got to be a little bit more because you are, you have someone else's life in your hands, because you're actually doing the diagnosis and, obtaining the history. As a nurse, it's already there and you're implementing the care plan. Now you are that. So it's hard. I do study a lot. The last semester is busy, just busy. It's just a lot of stuff, a lot of review hours, writing resumes, putting together plans, all kinds of stuff.
Got it.
But it's going to be all good. I'm going to make it.
You are. And I'm so grateful that you decided to come back and just say, hey.
Yes, of course. I love you. I love this program. Y'all better get this review. Do what she says. I'm telling you, it's a lifesaver. It changed my life. I will never forget you and Mark. I will never forget this program. In August, to all the ladies who are on in August, I'm going to come back and I want to give back. I want to purchase whatever you got going on at the end of August. Whoever are the repeat test takers that have failed and are here, I want to buy some type of review for them to help those ladies that were just like me. I mean, I had a family and I was scared, so I just went on and worked my union job for the benefits because I had my 2 daughters. I had to do something. So in the meantime, I came back. But yes, I'm here. Living proof, y'all. It works. Some people, I did get one mean message from someone and they said, I wouldn't want you to be my nurse if you failed the NCLEX 18 times. I said, well, I may not want you to be my patient.
Well, there you go. Right.
But I don't know. I didn't give up. It's about test taking and skills, but you got to know what I mean. Nothing's basic. Nothing's like you learn in school. It's about application. It's about scenarios and applications. I mean, get that review, do those questions. You got to get your mind do that because it ain't, hey, what's normal blood pressure? What if my potassium was below 3.5? It ain't none of that. It ain't none of that. No.
Thank you so much. You are the true definition of a Remar nurse. You have the heart, the perseverance, and you're willing to come back.
Thank you.
And I love that for you. Thank you so much for coming on here.
I appreciate y'all. Yeah, y'all hang in there. And if you do fail, just don't give up. Just pray. Change the way you study. Another thing, what I did, y'all, is I recorded myself on my way to work. I did videos. Just talk to yourself. Talk through that fact book. Just do it. Just record yourself. Take your notes. Put them on a ring. You stop at a red light, train, go anywhere on a cruise, on a plane, you're studying. Have that book. I'm telling you, it works.
I love it. Love it. Love it. Thank you so much.
You're welcome. Bye, y'all. Have a good day.
Love it. She said, don't text and drive. She said, quick facts and drive. She said, stop at the red light like, what is it? Polycythemia vera. I love that. Love it. But that's what it takes. It takes that type of dedication. It takes making NCLEX your companion. Making NCLEX your companion. You're going to do it. It takes that opportunity. When you see it, go after it. Remar Nurse University is the opportunity that I'm presenting. And I want you to just imagine yourself when you have that license and how much your life will change. And then think, what would I give up in order to get there? What would I give in order to get there? And when you think about the reward, because it's a lifelong reward, once you get your license, it will serve you the entire career. What little is required on the front end? You've already done the hard part. The hard part is nursing school. You did that. So at this point, it just takes a few additional days to make sure that you're ready, okay? To make sure that you're ready. So Remar Nurse University is coming every Monday in June. If you haven't signed up for it, it's super easy. Just go to remarnurse.com. The workbook will be going out. It will be going out this week. I'm planning for Wednesday, maybe sooner, but remarnurse.com is where you will sign up for it, Okay, I'm going to just do like 2 minutes of Q&A, 2 minutes of Q&A. Any questions that you have for me, go. Any questions you have for me, go. The first question I saw was about this book. Is there a difference between RN and PN? No. RNs and PNs both study for this book, okay? Both study for this book. So get it. This is the one you get. Number one, NCLEX instructor. Thank you, Vanetta. You are a great resource for nursing students like me who don't receive the content we need in nursing school. It's a thing. It's a thing. Thank you, Professor Regina. I'm here. I'm here for it all. I'm here for it all. Nursing school is tough. And honestly, if it doesn't suit your teaching style, you will struggle through it. Will you get through it? Yeah, you're going to get through it, but you may struggle through it, and then you may miss opportunities to learn new things because your foundation is weak. When you have a weak foundation, then it's more challenging for you to do the higher level things like prioritization, Okay. Is there an online version or online paperback? No, this book is physical. It's always physical because I'm a traditional instructor, and I do know that books help you learn. Books help you learn. All right. And so being able to take the book, write in it, huge difference. What is it? Okay, let me see. Is there, okay, so I did that one. What else? I'm not sure how to get the question bank. I'm not sure how to use the question bank. Okay, cool. If you have the question bank, that means you have my full program. What I will tell you to do is use the question bank as the 30-day calendar says to use it. So if you go into your file vault, which I don't have right here, but if you go into your file vault, there is a 30-day calendar of how to get through the program in 30 days. On the 30-day calendar, there is a section for answer that tells you when to do the question bank. You can choose to do it during the 30-day calendar, or what students will do is after they study the subject, they will go into the question bank and they will do that subject in the question bank. Okay, so those are 2 ways you could do it. Do it towards the calendar or do it by subject. How long will you suggest someone to do your program? It depends on how long you've been out of school. That to me is one of the biggest things. And then also how much time you're devoting to studying. If you've been out of school for years, I would say do the 3-month. Give yourself 3 months access. Okay. Also, if you know that you're working and you have kids and you're not going to be studying every day or every other day, give yourself 3 months access. The 30-day program, the 30-day calendar is if you are studying 5 days a week with the weekends off. So that takes a lot of dedication to study 5 days a week. It's not easy to do that. So realistically, if you can't do that, don't get the 1-month program. If you're not going to be able to study at least 5 days a week, get the 3-month. Okay, some of y'all may even be able to do the 6-month access because it'll just work better for you. Let me see. I finished the V2. What is the discount price if I want to continue the subscription? If you have done the entire V2 The price for the subscription is $50 per month if you just want to keep access to the platform. And so if you finished all of the lectures and you finished the book, the 2 books, right? You finish those, then you just want the question bank and to be able to review the videos. That's $50 per month. Okay. Got you. How many questions? Oh, over 2,500. Over 2,500. All right. And so do I have to use my link and my email to access V2? So yes, you need to. The email that you sign up with to V2 will be the one that you will log in with every single time when you log into V2. All right. And so that's the question bank there. You're able to create a test. There's actually 2,700 questions in there. So it's a lot for you to do. And those are next gen questions. Those are case study questions. Those are bow tie, fill in the blank, all those questions. Okay. Nurse Martin says, first attempt with 85 questions. I'm over the moon. So happy. Eternal grateful for you and your program. Content is key. V2 quick facts, and especially your Monday and Wednesday classes are. Hey, hop on. I want to see you. I want to see you. I want to see you. Let me know. Let me know. I want to hear that testimonial in person. That's pretty cool. What is the difference of the 199 and the 169 program? Okay, so what you're seeing here is the question bank actually being played out for those of you who don't know what the interface looks like. V2 is very specific because it's the dark mode NCLEX review, but our question bank shows up as the true NCLEX presentation. 199 and 169 program. You get the same thing in both of those programs. The only difference is the amount of time that you have access to the lectures, the question bank, the computer adaptive test. That's the only difference. You get all of my lectures, the question bank, 2 computer adaptive exams. You're going to get this book, which is quick facts. And then you're also going to get, and what I'm showing you now are the lectures that are done by me. And these are all subjects that are foundational, fundamental. You have to go over them. When people say they're doing Remar, this is what they mean. They mean they're doing my lectures, they're doing my questions, they're studying quick facts. Okay. It's an entire system. All right. And so you're going to get, again, everything that you need in one place. This is an example. During Remar Nurse University, we'll also be spotlighting my videos as well. You'll know my videos because they look different than anything else you'll ever see right now for NCLEX. They are meant for the audio-visual learner, the person that struggles with their attention span. Like me, you just want the information straight to the point. Surgical to geriatric. Okay, so that's me. Those are the questions that you will get in the program. That's what the video looks like. So it's very important for me to show you that, because sometimes when you get an NCLEX review, you don't know what you're getting. Okay, you don't know if you're getting slideshows, if you're getting flashcards, what you're getting. So it's important for you to see exactly what you're getting with that. How do I access the question bank? The question bank is going to be right under courses. Okay, so you'll see courses on the left-hand panel, and then you're going to see question bank. And question bank is going to be right there for you. Okay. Okay. Love it, love it, love it, love it, love it. I'm looking for the, this is what the calendar looks like. In the file vault, it'll say next gen or Remar study calendar for practical nurse or registered nurse. All right, so it'll be right there in the file vaults. I'm looking to make sure I have all my books so I can show you. Somebody says, what 2 books that am I getting? What 2 books? All right. So you will get, your first book is actually in the V2. In the file vault, you're going to get your student workbook. Okay, you're going to get your student workbook in the file vault, and that's something that you get immediately. You're able to print it out. So go there and print out your student workbook. The second book that's going to come with my course, all right, and that's what it looks like. You can print it out. It's 121 pages. Okay, so you can print that book out. That's one of the books that comes. It's important for you to print that book out, because while you're watching the videos, you are filling out the blanks in that workbook. Okay. So you should, anytime you're watching my videos, you should have that book that you printed out with you. The other book that you get with the course is Quick Facts, and I send Quick Facts to you. So I mail you this one. It'll come in about 3 to 5 days. That one in the file vault you can print out whenever you want. And again, it goes with the lectures. It goes with the lectures. Okay, make sense? Okay, I'm really enjoying your lecture. Looking forward to joining all your programs. Amazing, amazing, amazing. All right. What else? I am doing the, can you go back to the calendar, please? Because this is good. Oh, it's testimonials. Testimonials are in there too. For those of you who want the testimonials, they're all in there. But I did want to spotlight the calendar because I'm doing your videos, but how should I incorporate the questions? So let's look at the daily study calendar. Again, this is something that you can also access right into your studying. You should know every time you sit down, what does the calendar say I'm doing? Because if you're following the calendar, you make it big a little bit. If you're following the calendar, then you won't waste your time. Okay, let's go down to study session number, like maybe let's 4 or 5 or something like that. Okay, let's look at study session number 5. So inside of the course, there's already questions that are going to be testing what you're doing. So every time that you do a study session, you are going to know exactly what you're doing. Each study session, whether you're doing study session 4 or 5, it will tell you what to do, and you shouldn't be studying more than 3 hours. That's what I wanted to say. So for example, let's look at study session number 5. When you do study session number 5, the 3 videos that you will watch for that study session are going to be intravenous therapy, total parenteral nutrition, and pain management. Those are the 3 that you'll do. This is how you pass my program. This is how you do my program quickly. You're going to read study session number 4 notes. You will have those. The questions that you are answering for that day are only your clinical pharmacology exam. Okay. Those are the only mandated questions. Clinical pharmacology exam 3. If you want to do more, you can do the 30-day challenge video, session number 5. So there are some days where you don't have to go into the question bank at all. When you go into the question bank is when I tell you to. All right. If you're following my 30-day program. So for example, let's look at study session number maybe 12. Because in the beginning, the majority of work that you're doing is reviewing the concepts that you may have missed through nursing school. Okay. Reviewing the concepts. No, this was 14. 14 is where I have you going into the question bank. Okay. So again, my program doesn't focus on questions. It really focuses on making sure in the beginning you get the content. So 14 says what you're watching: management of care, legal issues in nursing. You have reading to do. So the reading is there as well. Like I said, if you're doing the calendar, you know exactly what you're doing every day. And then answering questions, up to an hour in the question bank. Now, when you're doing up to an hour in the question bank and you're here, you have concepts that you can be picking out in the question bank. So you can do management of care as a subject, or you can do legal issues in nursing. Okay, legal issues. So that is how I intend for you to use the question bank, but it is only if you are following the 30-day, the calendar. Okay. All right. So let that be your guide. Let that be your guide. Okay. But again, and then as well, there's only 20 study sessions in my program. So when you get through the 20 study sessions, that's when I tell you to do the computer adaptive exams. And there's 2 that come with the program. Okay. So everything you need, like I said, the price has everything that you need in it. And you're getting these additional resources to make sure that you finish, A lot of times we buy NCLEX prep or NCLEX resources. We never use them because either we don't know how, or we're buying so many different ones and they don't all go together. So we just give up. And the reason why I put everything together in the way that I did for you is so that you could be successful. So if you need a plan, get the 30-day calendar, get going. That's a great plan. Okay. If you don't have a system, V2 is the system that has everything in it that you need. Okay. It has your lectures and your questions. And my lectures are not long. If you look at my lectures, age-specific nursing care, 20 minutes, normal high-risk newborn, 16 minutes, 12 minutes. This is doable. This is doable for everybody. This video right here is what, 12 minutes.
We're going to talk about
diets. I play this one a lot. So one of the reasons that this is developed for you is because it's not going to take a lot of your time and you will be able to do it. So tap into it, okay? Tap into it, everybody. That is our Monday class. That is our Monday class. As you can see, this is a full video lecture. It is not any points where you're just like reading a PowerPoint presentation. There's nothing wrong with PowerPoints, but when somebody explains it to you, you remember it a lot faster. You know that y'all do. You know that y'all do. Okay. All right. So, all right, guys, all things considered, Monday motivation across the nation has been served. And we are on to the next thing. We had an amazing week. Now we're on to Wednesday. Oh, yes, definitely. Well, you have another discount program for Remar Nurse University. Yes. I will absolutely have another discount for RNU. It will be coming up. Like I said, if you sign up for it, you will get all of that information, guys. Okay. But we have been studying for almost an hour and a half. It's time to go. So until Wednesday, 9 p.m. Eastern Standard Time, I will be back for Winning Wednesday. Guys, but until then, it's about making sure that you understand that you will, and you must pass NCLEX. See you later, guys. Bye-bye.